بسم الله الرحمن الرحيم. بهاي المحاضرة إن شاء الله حنبتدي chapter 4 من كتاب أندروز طبعة 13 اللي هو ال Pruritus and Neurocutaneous Dermatoses. أول شيء حنبتدي بال Pruritus. Pruritus or itching is a sensation exclusive to the skin. It is the sensation that produces the desire to scratch. Pruritogenic stimuli first responded to by keratinocyte. أول شيء يتحفز هو الكيراتينوسايت، فبالتالي راح تسوي release to a variety of mediators. هذه المediators detected by fine intraepidermal C neuron filament. Approximately 5% of the afferent unmyelinated C neurons respond to pruritogenic stimuli. هذه النيرفز أو الفيلمنت راح توصل الإش sensation to the lateral spinothalamic tract to the brain, where a variety of foci generate both stimulatory and inhibitory responses. The sum of this complicated set of interactions appear to determine the quality and intensity of itch. عندنا شنو الستيمولاي اللي ممكن تسوي لنا itching or pruritus. Itching may be elicited by many normally occurring stimuli such as light touch, temperature changes, emotional stress, chemical, mechanical, and electrical stimuli may all elicit itching. The brain may reinterpret such a sensation as being painful or causative of burning or stinging sensations. Mediators, a large group of neuromediators and their receptors have been identified. Some of the most important mediators اللي لها علاقة بالإتشنج are the following اللي هي الهستامين H4 receptor اللي هو هستامين H4 receptor, tryptase and its proteinase, activated receptor type 2, opioid peptides, the mu and GABA opioid receptors, leukotriene B4, prostaglandins such as prostaglandin type E, thymic stromal, lymphopoietin, acetylcholine, cytokines such as interleukin 31, a variety of neuropeptides and vasoactive peptides, example, nerve growth factor, substance B, and their receptors, example, TRPV1 اللي هو transient receptor potential vanilloid 1. المختصر MAT. Investigation is ongoing to discover the relative importance of each of these mediators and to determine the clinical circumstances under which therapeutic targeting of these molecules will lead to relief of these symptoms. Classification. Itch has been classified into 4 primary categories as the following. 4 أنواع. النوع الأول هو pruritoceptive itch، هذا بسبب skin disorders. Neurogenic itch generated in the central nervous system and caused by systemic disorder. Neuropathic itch is caused by anatomic lesion of the central or peripheral nervous system. Psychogenic itch, the type observed in parasitophobia. An overlap or mixture of these types may be causative in any individual patient. Patterns of itching. There are wide variation in itching from person to person, and a person may have a variation in reaction to the same stimulus. Factors اللي تزيد الitching هي الheat will usually aggravate pre-existing itching, stress, absence of distractions, anxiety, fear, and itch tend to be most severe during undressing for bed. عندنا مصطلح اسمه الباروكسيزمال itch، هو يكون بشكل باروكسيزم فيكون severe pruritus with or without prior skin lesions, paroxysmal in character, sudden onset, often severe enough to awaken the patient from sleep. It may stop instantly and completely as soon as pain is induced by scratching. يوقف فجأة ويبدي بشكل باروكسيزم، أيضا يبدي sudden onset. However, the pleasure of scratching is so intense that the patient, despite the realization of damaging the skin, is often unable to stop of inflicting such damage. Itching of this distinctive type is characteristic of select group of dermatoses. عادة هيجي paroxysmal itching يجي with the following اللي هم lichen simplex chronicus, atopic dermatitis, nummular eczema, dermatitis herpetiformis, neurotic excoriations, eosinophilic folliculitis, uremic pruritus, prurigo simplex, paraneoplastic itch, usually secondary to lymphoma, prurigo nodularis. In general, only these disorders produce such intense pruritus and scratching as to induce bleeding. In individual cases, other disease may manifest with such severe symptoms. يعني هي هاي الأمراض اللي عدتناها هي أكثر شيء تسوي هذا النوع من الإتشنج الباروكسيزمال إتشنج. بس ممكن ببعض الكيسز ديزيز أخرى ممكن تسبب هذا النوع من الإتشنج. بس التريتمنت بصورة عامة للإتشنج عندنا الجنرال جايد لاين والتوبيكال ايجنت systemic treatment and phototherapy. أول شيء نبدي بالجنرال جايد لاين. keeping cool، لازم مكان بارد. avoiding hot baths or showers. avoiding wool clothing, which is a non-specific irritant as is xerosis. Avoid wash with soap, using soap only in the axilla and inguinal area. Avoid dry roughly. bathing dry يعني إنه يطبطب على المكان بالتنشيف، مو ينشف الجسم بقوة. Applying a moisturizer can help prevent such exacerbations. Soaking and smearing, if the itching is severe, may provide significant relief. example بالwinter itch. Soaking and smearing هي إنه البيشنت يبقى بالمي لمدة ربع ساعة تقريبا. ورا ما يخرج من المي ينشف جسمه bathing by bathing method، وبنفس الوقت إنه يبقى شوية يعني مو ينشفه تماما، ومباشرة يخليه الدراي أمسينيلون. فهذا راح يساعد إنه يعوف الجلد مالته يعني ويعوف يحافظ على المويسترايزيشن. Patients often use ice pack or hot water to ease pruritus. However, hot water can irritate the skin. It's effective. الهوت water هو صح إنه راح يسوي relief for short period, but over time exacerbate the condition. هاي فيما يخص الجنرال guidelines. topical agent ممكن topical anesthetic preparation ممكن تحتوي على البنزوكاين اللي هي ممكن تسوي contact sensitization، ممكن براmoxine أو lidocaine 5% ointment، أو etotic mixture of lidocaine and prilocaine ointment and lidocaine gel are preferred anesthetic that may be beneficial in localized condition. Etotic mixture of lidocaine and prilocaine and lidocaine may be toxic if applied to large area. ممكن نستخدم topical antihistamines بس هي عادة not recommended. ممكن الدوكسيبين كريم. الدوكسيبين هو tricyclic antidepressant بس يشتغل على الهستامين receptors. may be effective for mild pruritus when used alone. Doxepin cream can cause contact allergy or burning sensation, and somnolence may occur when doxepin is used over large area. Topical lotions that contain menthanol or camphor feel cold and cool and improve pruritus. They may be kept in the refrigerator to enhance this soothing effect. Lotions have a specific ceramide content designed to mimic that of normal epidermal barrier may be used. Capsaicin by depleting substance B can be effective, but the burning sensation present during initial use frequently causes the patient to discontinue its use. Topical steroid and calcineurin inhibitor affect a decrease in itching through their anti-inflammatory action and therefore are of limited efficacy in neurogenic, psychogenic and systemic disease related to pruritus. لأن هو بس عن طريق anti-inflammatory effect. بالنسبة للسيستميك تريتمنت عندنا الانتي هيستامينز which is the most common drug used by the non-dermatologist. عندنا two types اللي هي first generation H1 antihistamine تشتغل على receptor H1 such as hydroxyzine and diphenhydramine may be helpful in nocturnal itching, but their efficacy as antipyretics is disappointing in many disorders except for urticaria and mastocytosis. هاي فيما يخص ال first and second generation هم أكثر شيء effective بالurticaria and mastocytosis. Doxepin is an exception in that it can reduce anxiety and depression and is useful in several pruritic disorders. Sedating antihistamine should be prescribed cautiously, especially in elderly patients because of their impaired cognitive ability لأن هو يسوي sedation ويعني بالold age ممكن عندهم impaired cognitive ability ف used in caution. Non-sedating antihistamine and H2 blockers are only effective in urticaria and mast cell disease. Opioid altering agents. Opioids are involved in itch induction. Activation of mu opioid receptors stimulate itch. Kappa opioid receptors stimulation inhibit itch perception. However, the interaction is complex. فهسه عندنا هذا يحفز الميو والكابا يعني بالعكس إنه inhibit itch perception. Opioid altering agents such as naltrexone, naloxone, nalfurafine, and butorphanol have significant side effects and varying mode of delivery, ممكن intravenous, intranasal, and oral. Initial reports of benefit in one condition are often followed by conflicting reports on further studies. These agents most useful in cholestatic pruritus. يعني هو أفضل شيء في الكوليستاتيك pruritus بخصوص الستدي عليهم إنه ممكن إنه أكو ستاديز تقول إنه مفيد وستاديز إنه يعني عندها إشكال ويا الأوبيويد altering agent من ناحية الفائدة مالتها. Anticonvulsant central reduction of itch perception such as gabapentin or pregabalin. Antidepressants such as mirtazapine and selective serotonin uptake inhibitors. These takes from 8 to 12 weeks to attain full onset of action. Thalidomide through a variety of direct neural effects, immune modulatory action, and hyposedative hypnosedative effect is also useful in selected patients. Phototherapy عندنا ultraviolet rays type B, UVA, Soraline plus UVA اللي هي البروفا may be useful in a variety of dermatoses and pruritic conditions.